Hi, my name is Bryson. If you're watching this, Dr. Oliver added two special breathing patterns to your at-home exercises. To create specific physiological shifts, we're going to do two very specific breathing patterns that will stimulate certain parts of your brain and your nervous system. Simple deep breathing is always a good idea, but this is a very specific exercise designed to create very specific changes in your nervous system. You'll notice some immediate benefits after each session, but as you do these consistently, you'll be amazed at how much better you feel. The first is what we call box breathing. This is the one we want you to do 5 times throughout the day along with your other exercises. It's going to improve your heart rate variability and regulate your hypothalamic pituitary axis. This is how we do it. Breathe in slowly through your nose for 4 counts, focusing on expanding your stomach and then filling your entire lungs. Then hold it for 4 counts. Then, with pursed lips, exhale all the air for 4 counts as if you were playing a trumpet. Then, when your lungs are totally empty, hold that for 4 counts before inhaling again and repeating the cycle. Do that at least 4 times, but of course, doing it longer will help even more. Each count should be about 2 seconds long. Or if that feels too easy or simple, use a 5, a 6, or a 7 count. If it helps, you can keep the count with your fingers. I'll demonstrate. This teaches your nervous system to shift back and forth between sympathetic and parasympathetic states, making it easier to switch back to a calm, relaxed state after anything stressful. When we breathe in, our sympathetic nervous system becomes slightly more dominant. And when we breathe out, our parasympathetic nervous system becomes slightly more dominant. So by breathing in this slow and deliberate manner, we practice shifting back and forth between the two states, creating a better dynamic balance. Most of us get stuck in the sympathetic fight or flight state, which leads to chronic stress, adrenal fatigue, poor sleep, increased inflammation, and more. All of which is draining on our nervous system, our immune system, cardiovascular health, gut health, and endocrine system. So, by getting better at quickly shifting our state, our body becomes better at switching out of the sympathetic state when we no longer need it and back into the rest, digest, and heal state. There's also a reason why we breathe in through our stomach and then finish by expanding our chest. By expanding and breathing through our gut, we fire the phrenic nerve, which is connected to some key areas of our deep brain and brainstem. Then, when we finish each inhale by expanding our chest cavity, we force more air into our lungs, which opens back up all the alveoli so we can get more oxygen. Over time, a lot of alveoli collapse and get stuck, slowly decreasing how much air we can bring in and how much oxygen we can absorb. By deliberately expanding our lungs to their max, we reset our lungs and maximize our oxygen intake. Breathing with tight, pursed lips also helps with this while also stimulating the facial cranial nerve. Because our brain uses more oxygen than any other part of our body, especially when trying to heal or make neuroplastic changes, when we get more oxygen, it makes a huge difference for our brain. The box breathing technique should be done on a regular basis. That's our foundation. Then, when you feel yourself getting stressed, overwhelmed, or anxious, you'll do this next one. Maybe you notice your shoulders tensing, or your breathing has become shallow and quick, or you notice you're more irritable, or maybe you even consciously recognize that you're stressed. This exercise will quickly downregulate the sympathetic response, the stress response, and turn on the parasympathetic response. It's called the sniff, sniff, sigh method, or the physiological sigh. Take a big inhale through your nose, expanding your stomach again. Then, without exhaling, take another fast, sharp inhale to completely fill your lungs. Then exhale it all through your nose or mouth. Pause a little at the end of your exhale. Repeat that about 5 times or until you feel relaxed. This is what it looks like. This is where things start to get really cool. We're going to incorporate what we call neurological layering. We're taking what Pavlov learned about his studies with dogs in classical conditioning and applying it to a clinical setting to supercharge the effectiveness of your treatment here at the clinic. It's going to make each therapy we do here at the office more effective. The results will last even longer and will make it possible to recreate the therapeutic benefits of these in-office modalities while at home, work, or even on vacation. Here's the catch. This part of treatment is 100% completely dependent on you and your commitment to your own healing process. This part of treatment is completely and totally free. Because of that, it's sometimes easy to ignore, undervalue, or even forget about. But if you stay committed to the process, we know it will make a huge difference in your treatment here at the Neuro Clinic and in your continual health journey going forward. Along with doing these breathing exercises at home, Dr. Oliver also wants you to do them during your therapies here at the clinic. This creates a synergistic effect, providing more benefits combined than if you just did the therapies and the breathing exercises separately. Studies have shown that when physiological exercises like these are done while specific parts of your brain are being activated, such as during RPSS, NSI, TMS, Rebuilder, Alpha Stim, and others, it yields better results. For example, RPSS therapy activates key part of your brain, including the insular cortex and the amygdala. And these breathing exercises we showed you activate the left dorsolateral prefrontal cortex and the anterior cingulate cortex. So when we do both together, these parts of the brain form extra connections to each other and become linked. After this connection has been established, anytime you do RPS therapy, you'll also get the benefits of doing these breathing exercises. And when you do your deep breathing exercises at home, it will also cause the RPSS parts of the brain to fire as well, almost as if you are receiving RPSS therapy wherever you are. How cool is that? So how do we do this during our therapies at the clinic? It's simple. Whenever you're receiving a treatment, whether it's RPSS, AlphaStim, TMS, the force plate, NSI, Rebuild, or even HBOT, practice the first breathing pattern, box breathing. Of course, you can still talk with text and have conversations. Just when you're not talking, try to shift to that slower breathing pattern. Remember, 4 counts breathing in, hold for 4 counts, exhale slowly for 4 counts, and then hold it at the bottom of your exhale for 4 counts. When there's a lot going on around you, it can be easy to lose track of your count. This is where keeping count on your fingers can come in handy. We'll do our best to remind you of the breathing exercises when you come in for therapies, but even if we remind you, this part of your treatment is up to you. We know that as you add this aspect to your treatment, you'll notice deeper and longer lasting benefits. If you have any questions at all, please come talk to a tech or Dr. Oliver and we'll help out in any way we can.